My name is Dr. Cozy. It's really nice to meet you. Real quick to get started, can I just get you to verify for me your name and date of birth? Okay, perfect. And okay, so your ears have been feeling really sensitive and you've been feeling a lot of pressure in them recently. Okay. When did that start? Have you had any kind of hearing loss, either in both ears or just one? Okay. So just pressure. Any dizziness or ringing in your ears? How about any drainage, like a stuffy nose, drainage into the throat that you might have noticed? Okay. How about a sore throat? Okay. Any recent colds? And have you taken any medication to try and alleviate the symptoms? Okay. Did that help at all? Okay. And do you have a history of ear infections? Just taking a look at the rest of your paperwork here. So let's go ahead and get started so we can get on the path to figuring out what's going on with you. Alright. Going to start by taking a look inside of your ears. Let me know if you're having any kind of discomfort or tenderness from the otoscope, okay? So, start with your right. And I'm just going to very lightly just pull your ear back a little. A little easier for me to see here. out any drainage. Okay. Okay. Well, that looks good. Take this off because this went in your nose. And take a quick peek at your eyes. So just keep them open. You don't need to do anything. Just gonna lightly pull your lids down. Is that okay? Thank you. This side. Right. And one more thing with my light here. Can I get you to open for me? Thank you. Not seeing any redness or active postnasal drip. Any signs of drainage? Okay. Going to very gently sort of palpate around your ears, feel the external structure, and then I will be feeling along your jaw and down your neck. Okay, looking for any signs of inflammation or irritation. I'm not feeling anything that is concerning to me. like to do here real quick, and then I'm going to be proceeding with an ear cleaning, okay? Because particularly the right side has quite a fair bit of cerumen inside of it, which is a fancy name for earwax. And I think that that imbalance is what's contributing to the sort of pressure that you're feeling, as well as the intermittent dizziness. So I think if we give your ears a good clean, that should alleviate those symptoms. And if it doesn't, then that also lets us know we need to look a little bit deeper. Okay? Okay. Plus, with your ears clean, I'm going to be able to visualize your eardrum and get a better picture of what's going on. Be able to see if there's any fluid in the ear. Okay? Okay. What I'm going to do now is I'm going to be turning your head from side to side. While I'm doing that, I'm going to be watching your eyes, so intense staring. The reason being is that I'm looking for something called nystagmus, which is a flickering of the eyes due to the feeling of losing our balance. And I can recreate that by turning your head. Okay. So if at any point you start feeling dizzy or you're feeling a lack of balance, please let me know, okay? Okay. So we're gonna go slowly, okay? Okay. How does that feel? Okay. Let's try it again, alright? Turning. And again. Turning. And back to me. Any dizziness, motion sick feelings, or anything? Okay. Well then, we're going to get down to business here, okay? So, to start, I'm going to be just placing some paper drapes over your shoulders. to help and protect your clothing from any potential drips, okay? I have this piece in here that should be doing the protection for us. I don't know if I'm going to be using irrigation on your left ear, but we will be using it on your right, which we will do with this device here. So you'll see that it has this portion around it here. So this little nozzle here has a protective tip, so that way it's gentle in the ear. I'm going to be flushing with water, which is warm, so don't worry. And it doesn't hurt at all, it's just kind of tickly, okay? And then anything that comes out will get caught in this portion right here, go down the tube into our basin. So normally we don't have any kind of issue with drips, but just on the off chance we have those drapes. Put that down for now. Myself a drape here for wiping purposes. And I'm going to be starting with your left ear, just using this little brush here, okay? It's going to gently remove some of that cerumen and anything that's stubborn. I will go in with either a carrot or a tweezer to remove, okay? If at any point you're feeling any kind of discomfort, any pain, anything, I want you to let me know, alright? So, I'm gonna start think we took care of that side. Let's take a look. Man down, okay. It happens. Okay. So let's take another look here. Do you feel me pulling the ear back? Okay, that looks a lot better. A little bit of redness, but I think that's because I've been messing around in the ear canal. Not seeing any kind of drainage, fluid in the ear, which is good. Okay. So now we're going to take a look at the other ear. Just take a quick note, and then I'm going to run an applicator just on the external part of the ear just to clean it a bit. So this is just going in the external nooks and crannies here because I got a bit of CeraVe on them. We're gonna set up for this side. So just getting some of your hair out of the way here. And I'm gonna see if I can't start just sending up just a little bit here. Just so I can get my nozzle in the ear canal. some discomfort here. Just have to make sure. So I'm gonna go in now. My spray bottle, okay. So this goes just right here like so. You ready? How are your ears feeling right now? Good. Okay. I thought that would help give you some relief. Just going to clean up the right side. Okay. And real quick, let's take another look at your throat, okay? So, open for me. Thank you. Yeah, I'm still not seeing any kind of drainage. Okay. Just need to rule that out. Sometimes when there's a considerable amount of wax present in the ear canal, it can hold any fluid in place, and that can prevent us from seeing whether or not there is the presence of otitis media or an ear infection, okay? But I'm not seeing anything like that. Do you feel like you're sniffly at all? Okay. So just to completely rule it out, I am going to turn your head again, okay? Okay. So intense eye contact commencing. Okay. Right. I'm not seeing any nystagmus. Are you feeling any dizziness at all? Okay. I'm just gonna palpate again. Everything feels normal to me now. How do you feel? Okay. So no sensation of dizziness or loss of balance, no ringing or anything like that in the ears. How's the pressure? Good. Okay. Let's get these drapes off of you. Pop you over there. Take off my gloves. Okay, just looking at your meds here. No, drug allergies. Okay. I don't think there should be any kind of interactions. So, I'm going to prescribe you some ear drops, okay? And I'm going to ask you to use those twice a day for the next week. And then, as needed, if you start experiencing that buildup of cerumen in the ears again. Alright? It doesn't sting at all. It does sort of have a fizzy, crackly sensation as it helps break up any cerumen that might be there. You'll want to let it sit in the ears for about 30 seconds and then kind of let them drain. So I recommend doing one at a time. So you put some in one ear and you just kind of lean your head over, or you can lie down just to save your neck, and then repeat on the other side, okay? Okay. So everything fresh in my mind. Go ahead and CC a copy of my notes to your primary care physician. Let me just make sure we have that information. see on here for you as well. Okay, so if over the next few days you start experiencing a stuffy nose, any sore throat, or scratching, itching, discomfort in the throat, if you start feeling that pressure come back or plugged ears, then I want you to return to clinic, okay? Okay. I will be calling to check on you and see how you're doing. I'll probably give you a call tomorrow. Alright? Okay. Do you have any questions for me? Okay. Well, if you happen to think of anything, let me know, okay? Feel free to give me a call. Okay. It was really nice to meet you.